The deadly respiratory disease MERS may now be global after an infected German man died in hospital.
The
patient had a very serious virus, the MERS coronavirus. This virus destroys lots of pulmonary tissue, and at the end of the day, when the infection passes, when the virus is no longer detectable, then the tissue is very badly damaged, and very often there are secondary complications as a result.
The 65-year-old man is believed to have been infected after visiting an animal market on the Arabian Peninsula in February. His death in Germany marks the first MERS-related fatality in Europe and has stirred fears on the continent of an outbreak. But experts have urged caution, saying there's no indication he had infected others.
Everyone who was in contact with the patient, including the family and people involved in the medical care, no one is infected.
MERS is caused by a coronavirus from the same family as the one that caused SARS. It causes symptoms including coughing, fever, and pneumonia. It is more deadly than SARS, but it's not as easily transmitted.
The virus is very dangerous when the infection has been triggered, but the chance of transmission is small.
And while it's the first in Europe to report a MERS-related death, Germany is not the only country on the continent to feel threat of the killer virus. A 25-year-old Czech man who returned from a hiking trip to South Korea is suspected of being infected and has since been hospitalized. And in neighboring Slovakia, a hospital is testing a South Korean man in another suspected case of the virus. Hu Zhiqiao, CCTV.